I'm Dr. Ravikiran. I'm a neurosurgeon, and I thought I'd speak today about a topic which is of very critical importance, that is head injury. Head injury is usually isolated, or it can be part of polytrauma wherein you have multiple injuries. For example, injuries to the lungs, to the abdomen, fractures, limbs, etc. Usually they arise from impact to the head. That might arise from a fall, that might arise from a vehicular accident, you might be within the vehicle, you might be a pedestrian. Why is head injury of critical nature? That is precisely because if immediate addressing of the problem is not done, then the damage to the brain might be permanent, and the brain as such does not have a lot of capacity to regenerate, and hence you might be left with a lot of deficits, that is something like paralysis, etc. So what exactly happens in head injury? As you know, the brain is covered by the skull, which is a hard structure, and hence whenever there is an impact, there might be fractures. The fractures might be on the upper surface of the skull, it can be on the base of the skull also. The brain is covered by bone even on the lower aspect. There might be situations where there is bleeding. The brain is covered by 3 layers of protective covering. The one immediately inside the skull is a thick membrane, which is the dura mater. Next is a slightly softer membrane called the arachnoid. And third is an even softer membrane which covers the surface and drapes the surface of the brain. It's called pia. So when there is bleeding, the bleeding may occur between the skull and the outermost membrane, which is an extradural bleed. It can occur between the first and the second layer, which is a subdural bleed. It can occur between the second and the third, which is a subarachnoid bleed. The bleeding might occur within the very tissue of the brain. That is an intraparenchymal bleed, what is called as a contusion. Sometimes there is a very diffuse, confluent, very vague type of very small dot-like bleeding occurring on a very large area of the brain. It's called diffuse axonal injury. So how does the patient present when such an event occurs, that is during an accident or a fall? The patient usually comes to the emergency department or to the casualty. The patient might come in an unconscious state. The patient might be conscious, but he might be very sleepy, drowsy. He or she might have a lot of nausea, he might have vomiting, there might be convulsions, or sometimes the patient can also come with weakness, paralysis-like situation. Now within all these injuries that occur, is surgery required for all of them? No. Surgery is required only if the bleeding is large enough to cause what is called as compressive effects on the brain. The brain, while it is held protectively within the skull, has a very limited space. If the space that was supposed to be occupied by the brain is now occupied by, say, a bleed, or for that matter in other situations even tumors or anything, then the brain has very limited capacity to adjust to this new space occupying lesion within the skull. If the borderline area where the brain is no longer able to adjust is breached, then the brain starts having compressive effects, what is called as raised intracranial pressure. So when a trauma happens and when there is bleeding, if the bleeding is already causing signs of raised intracranial pressure or is threatening to in the next few hours, then in such situations it is better to remove this offending agent. It can be a bleed, it can be a fracture, it can be a bleed within the very tissue of the brain. It is important to alleviate this, because if it is not alleviated, then the damage to the brain, once permanent, cannot be recovered. So how do we avoid such situations where there is trauma? We live in a very fast-paced life today. We travel. Hence, sometimes by freak accidents, you may end up in a situation where someone known to us has an event of trauma. In such situations, it is important that everyone has an earmarked area, a hospital close to where you work, close to your residence, which is earmarked in case of emergency. You know that in such a situation, you have to go to such a hospital. The hospital needs to be equipped. We need an immediate CT scan to know if there are bleeds, if there are fractures, if the fractures are aligned, if the fractures are displaced and gone into the surface of the brain. The immediate management of such patients depends on very early investigation and immediate treatment wherever necessary. Where not surgically required, the patient requires intensive monitoring, ICU cares, and later on nursing care, so that the patient is very quickly integrated back to a normal life. Other than that, how do you avoid injuries? You maintain all safety parameters. Safety while driving your vehicle, seat belts, use vehicles which are safe, helmets while driving two-wheelers, both for the rider and the pillion rider. Absolutely avoiding driving under the influence of alcohol. Sometimes it may also be important for us to carry a piece of information regarding our identity within ourselves, like within our wallet, in case such an event occurs where you can be identified. Your blood group may be mentioned in that. If you have any allergies, if you have any pre-existing conditions, for example, you are on some blood thinners from some cardiac condition, these all may be mentioned in a very small chip and placed within your clothing or within your body, within your wallets, so that when the first responders arrive to the scene, they are aware that these are the precautions that need to be taken. Overall, as a society, we need to know and we need to get trained in first aid. In many of the Western countries, first aid is a part of education. Even a common layman will be able to help in a case where the first responders, the ambulance drivers, are not able to reach the ambulance, the paramedics. We have to grow this system within our society also, so that every life can be saved.